Download our app available from the App Store and Play Store. Hello and welcome to Medical Dialogues. I'm Roshni. Let's look at today's daily bulletin. The NTA introduced changes in the eligibility criteria for OCI PIU card holders appearing in NEET UG 2023. Indian medical aspirants living abroad will be able to check the corrigendum at the official NEET website. As per the revised guidelines, Indian nationals, NRIs, OCI, PIO and foreign nationals are eligible for admission in medical, dental, Ayurveda, Siddha, Unani and homeopathy colleges. Amid rising corona cases, the Health Department on Saturday redirected all private pathology and diagnostic centers to conduct COVID tests at prescribed rates. Earlier, these orders were issued on December 29 last year. Private lab operators can charge up to Rs 900 for RT-PCR for home collection and up to Rs 700 if an individual visits the lab. Delhi and its neighbouring states have emerged as a major COVID-19 hotspot over the past few days of the current surge. In the last 7 days, Delhi reported 24 deaths linked to COVID, the highest in the country, and logged the second highest number of cases at 7,664. Taking stringent action against 2 doctors who have been found guilty of medical negligence and misconduct, the Telangana State Medical Council has suspended their licenses by removing them from the medical register for a period of 6 and 3 months and taking away their permanent registration certificate for the duration of the punishment imposed. According to the Medical Council orders issued DSMC Chairman V. Rajalingam on April 12th based on Regulation 8.2 of the Indian Medical Council, Regulations of 2002, Dr. Karan M. Patil's name has been removed from the medical register for 6 months for the surgery on the wrong leg, while Dr. C.H. Shrikant has been suspended for 3 months for allegedly delaying in referring a case to a higher center. The vaccine technology America learned about during the pandemic was originally aimed at cancer, but its use against infectious diseases took off in the pandemic. Now, a new study suggests specially designed mRNA shots can help prevent recurrences of melanoma, a dreaded skin cancer. The study presented on Sunday at a research conference showed that after nearly 2 years, patients who received a personalized mRNA vaccine made by Moderna and Merck were 44% more likely to be alive and avoid new tumors than those who received only the standard of care. If the results hold up in a larger, longer study planned to start later this year, it will mark a dramatic turnaround for cancer vaccines, which have been tested and failed for decades. These vaccines are designed to prevent cancer recurrences, not an initial run-in with the disease.
The presence of a misfolded alpha-synuclein protein can be used to determine if people have Parkinson's disease. According to a new study using technology developed by a researcher at UT Health, Houston, this biomarker could pave the way for the development of better diagnostic tools and new treatment options for the disease. Researchers at Amprion studied 1,123 participants who were enrolled at 33 facilities globally between July 2010 and July 2019, representing the largest analysis so far of a synth-seed amplification assay or SAA for the biochemical diagnosis of Parkinson's disease. Of these, 545 had Parkinson's disease, 163 were healthy people with no evidence of Parkinson's, 54 had evidence of the disease on brain scans, 51 were in the early stages of the disease, and 310 had genetic mutations that are known to cause Parkinson's but hadn't yet done so. This large and well-characterized collection of samples was put together by the Parkinson's Progression Markers Initiative or PPMI. People experiencing hearing loss who are not using a hearing aid may have a higher risk of dementia than people without hearing loss, suggests a new study published in the Lancet Public Health Journal. However, using a hearing aid may reduce this risk to the same level as people without hearing loss. Dementia and hearing loss are common conditions among older adults. The researchers looked at data from more than 430,000 people who were part of the UK Biobank database. The average age of study participant at recruitment was 56 years old and the average follow-up time was 12 years. In a paper published recently in Molecular Psychiatry, a team of scientists from the University of Pittsburgh, in collaboration with researchers in Italy, described shared patterns of sleep disturbances and irregularities in daily rhythms of rest and activity across patients with schizophrenia spectrum disorder or SSD. By using wrist monitors that measured activity and rest as proxies of wakefulness and sleep. Researchers found that individuals with SSD who resided in psychiatric hospitals and those who managed their condition in outpatient settings had erratic sleep patterns, dysregulated transitions between sleep and wake cycles, and excessively rigid daily routines that were predictive of worse SSD symptoms and correlated with poorer quality of life. Preclinical study using stem cells to produce progenitor photoreceptor cells, which are light-detecting cells found in the eye, and then transplanting these into experimental models of damaged retinas has resulted in significant vision recovery. This finding by scientists at Duke NUS Medical School, the Singapore Eye Research Institute, and the Karolinska Institute in Sweden marks a first step towards potentially restoring vision in eye diseases characterized by photoreceptor loss. Photoreceptor degeneration occurs in a variety of inherited retinal diseases such as retinitis pigmentosa, a rare eye disease that breaks down cells in the retina over time and eventually causes vision loss, and age-related macular degeneration, a leading cause of vision impairment worldwide. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.